issues that the public, the legislature, and the other two branches of government had identified with the delivery of services to especially our foster children, but all families and children that are touched by our child protection and child welfare system in Georgia. The idea was that we needed an independent oversight agency to assist that, as friends of mine that work at DFACS say, nobody wants DFACS to investigate DFACS. And that just makes a lot of sense. And that was really the emphasis behind the creation of the Office of the Child Advocate. We were given a variety of statutory duties in addition to that to assist and kind of oversee the state's child welfare system, and especially the state's child welfare legal system, by providing individual case evaluations, helping to solve systemic problems, and also to work on education and advocacy to improve outcomes in our child welfare system. And so our main statutory duty that we really focus on most of the time is our duty to investigate and seek resolution of complaints that the Division of Family and Children's Services or other state agencies have violated law or policy in working with our children. Most of the time that deals directly with the Division of Family and Children's Services. And I'm doing a bad job of saying, please advance the slide, but we'll get the guy behind the curtain to advance the slide one more time and one more time. Great, thank you. So we receive these complaints from a variety of sources. We have a public-facing website, which is probably where we get most of our complaints from. Members of the public usually logging onto our website and giving us detailed complaints about children in the child welfare system. We also have personal contact from judges, legislators, agency officials letting us know. Commissioner Brose and I had a phone call earlier this week where she asked me to take responsibility for providing some additional oversight into a tricky case in South Georgia, and we've been working with them very closely on that. So we have direct contact requests that result in our office opening cases as well. And then, of course, folks communicate very regularly with the governor's office for a variety of complaints. And when those touch the child welfare system, those are forwarded to our office and the Division of Family and Children's Services Constituent Services Office. And we work together with them to resolve those in an appropriate way. So next slide, please. One of the things that is really helpful in this work that we do is that we're able, through looking at a lot of specific cases, to sort of extrapolate from the problems in each specific case to look at that systemic issue, the sources of systemic issues, so that we can try and actually improve the system. It's one thing to fix this case and that case and that case. It's another thing altogether to start looking at the causes for why we need to fix this case and that case and that case, and try and say, what can we do to prevent these things from happening altogether in the future? That's one of the strengths of our office, is that we have a lot of insight through the work we do into these systemic challenges. And so these are some examples of some of the things that we see repeatedly when we're dealing with child welfare cases. The lack of a proper assessments, the lack of proper follow through, the lack of proper documentation, inappropriate communication with parents and caregivers, and making sure that we're making reasonable efforts towards permanency and appropriate service delivery to families. These are the things that we just see over and over and over again. And one of the wonderful things about the office at this point in time is that we've had a wonderful working relationship with DFACS leadership, especially state leadership at all levels, so that we can address these types of problems collaboratively and talk about them honestly and work together to come up with collaborative solutions. And that's exactly how we attempt to work on these things. So if I could move to the next slide, please. Some of our additional duties in our statute and otherwise are that we have a requirement to provide initial certification for guardians ad litem working in juvenile court cases. We have an agreement with the Council of Juvenile Court Judges to provide that initial 8-hour statutory training that was created recently, that requirement for juvenile court intake officers. We serve on the State Child Abuse Protocol Committee, and we also, along with the division, serve as a clearinghouse for the state child abuse protocols. Every county, when it comes up with its written protocol, has to give that to us and to the Division of Family and Children's Services. So we work together collaboratively with DFACS to serve as a clearinghouse for those protocols. We also serve on the GBI's Child Fatality Review Panel, and we also have a statutory duty to be the third-level foster parent grievance mediator. So we mediate those if they can't get through the first 2 levels of foster care grievance under the Foster Care Bill of Rights in Title 49. So we have a wide variety of duties. And I'd like to segue from that into the next 2 slides, please. So we're basically, as someone said, you're probably the smallest agency in state government. I don't think we are quite the smallest. I think there's another one maybe smaller than us, but we are one of the smallest agencies overseeing one of the largest agencies in the state. So we just describe ourselves as a very small agency with a very big mission. And now to look at that mission in real detail, I want to take a look at our workload data. So I've got a snapshot. If you go to the next slide, please. Starting back in 2019, which is kind of our last pre-COVID year, which would give you a really good idea of what our work looked like before COVID hit. We were working at that time with 4 full-time investigators and 1 full-time intake investigator. Our intake process, that process of receiving and responding to those telephone calls we get, the letters, the web forms, that's really a full-time job, and it can take an enormous amount of time. So in the past, we had a full-time intake person, but that intake person also had an investigative caseload. So we essentially had about 5 investigators. We had almost 500 cases that we responded to in 2019. So we had about 57 cases per investigator in 2019. And we were responding to most of the complaints we received by opening investigations. And if we can go to the next slide, please, you can look at 2020, which is a dramatic change. And the funny thing about this, most of this change is actually not really due to COVID. We didn't receive that many fewer complaints in 2019 than we did in 2020, just over 400 in 2020. We lost a full-time intake investigator. That person was replaced with a part-time intake investigator who did not carry a caseload. So we were down to 4 investigators for roughly the same size caseload of initial intake. One of the things that the office did before I got here to respond to increased workloads and lack of resources to address those workloads was they began screening out more and more cases. So you can see that in 2020, we went from investigating most cases that came to our office to screening out most cases that came to our office in order to kind of keep their heads above water. And if we can look at 2021, the last full year's data we have, which is the next slide, you can see that we were, or you will be able to see, I hope, very shortly. If we can get to the next slide. See, it's all about collaboration and working together. The 2021 workforce review, we were ultimately in the first 6 months, really, most of this was driven in the first 6 months before I came. We were screening out 3/4 of every complaint, of all the complaints that came to our office. And that seemed very strange to me with my experience in the child welfare system. Obviously, there are a lot of spurious complaints out there, but it seemed very odd to me that 75% of people that bothered to get on the website or make a phone call or contact a representative or somebody in the governor's office was making a spurious complaint. So I started reviewing individually each and every intake when I took office in 2021 in June. I revamped our requirements for screening out. And since I came on in June, we've actually only screened out about 35% of cases. And I expect that to go even lower because we're really getting a lot of quality reports from folks that merit looking into and shouldn't be screened out. The result is that our average investigator workload, while it rose slightly in 2021, is going to go up a lot going forward because we're not going to be screening out this number of cases. We also inherited a large backlog from 2019 and 2020, which has our investigators working just on the complaints that come through that get moved to investigations at about 61 cases per investigator now, which is higher than it was in 2019. And if I can go to the next slide. We also cooperate with the Division of Family and Children Services to look into those most troublesome cases where we have child death and serious injury cases. These are the cases that wind up, in the press and that need an objective outside eye to assist the division in trying to troubleshoot what happened in those cases. So 2 of my 4 investigators, one of those investigators is on Family Medical Leave Act right now. So 2 of my 3 active investigators are specially trained through a national initiative to do this type of child death and serious injury interviews and inquiries and quality investigation. And so in 2019, those 2 investigators, in addition to their normal caseload, had 11 CDSI interventions. We're up to 112 for 2021, and we expect that to continue to go up. So that's a lot of extra work for over half of our active investigators. And then finally, if I can go to the next slide on this workload, in the past, the Office of the Child Advocate did county audits, which is one of those system improvement tools. When you hear again that one county has this problem and this problem and this problem, eventually it seems that our time is better spent looking for systemic causes to these problems and just putting Band-Aids on individual problems. So our office used to go out to counties where this was going on and pull random cases from court files and defects files and look at those for systemic issues, and then work with the division and with the courts when necessary to resolve those issues so we got better outcomes for kids. We stopped doing that. And now we have reinstituted those. So we have one right now, and we have 3 more in the bullpen ready to go. So this is gonna work out to having still more caseload for our investigators right now going forward. If I can move on to the next slide. I've really refocused what we do now over the work of the past 2 or 3 years on our essential statutory duty, back to trying to really answer these investigations, these complaints, and investigate them when appropriate. And that's causing an increased workload on our investigators. We need to redeploy our resources into the field. There are some cases that have factual questions that can't be answered by looking at shines or talking to somebody on the telephone. So for instance, just recently, I took a trip to Thomas County to watch court and to try to resolve some factual questions about things that were going on there with that system that was badly impacting a child in that case. And we were able to affect a good outcome for the child in that case by being personally involved with the court hearing and meeting with all the participants and talking to them. So we need to be able to get back out into the field and do that kind of work again, which is a drain on resources as well. And we had also stopped communicating, for reasons I don't really understand, our findings to the Division of Family and Children's Services. So the first thing I did was say, well, we're going to start communicating those findings again. We don't want our investigators working in the dark, opening cases and closing them with nobody knowing what happened. That's very important to me. It's been very important with DFAC's leadership. As I said, we have a very good relationship, and we're making recommendations to them in specific cases, both at the state level and at the county and regional level. And we're finding that that's actually affecting outcomes in a positive way. And then, as I've said, we're reducing the number of screen outs that we take. So if we can get down to the next slide, which is the real bullet of the entire thing, on our amended budget, we are asking for $246,000 in order to do the things that I've just described to you. I told OPB, I said, I know everybody comes to you and asks for money right now. And yes, of course. I said, I think most of the folks are coming and asking for the ability to enhance the work that they do. We're asking for the ability just to comply with our basic statutory mandate. Our case managers, our investigators are barely able to keep up with their caseload now. We're asking for the ability to hire 2 new investigators as soon as possible, qualified investigators. We have very outdated technology and infrastructure with no case management system. It's very difficult for us to find out exactly how many cases we have at any given time and what's going on in any one of those cases at any given time. So we're in the process of procuring a case management system that's designed for state ombudsman offices. And again, we need to be able to deploy our staff into the field. We need to be able to have them going out and visiting courts and traveling the state again. So that is what this is in aid of in order to do this. And I'm happy to answer questions if the members have questions. I'm sensible of your time as well. My contact information is on the last slide, and you've got that printed as well. So if you have any questions outside of this hearing, please feel free to contact me.
Thank you, Director Bruce. Sounds like you have hit the ground running, and I appreciate it. I want to tell you before we even start, see if there are any questions, how much I appreciate you reducing screen outs. That is a huge thing that's kind of hard to understand a lot of the time. And I know your work as a SAG probably also has helped you realize how important that is, that there are those very cases that do merit further consideration. So thank you for making that a priority right now. Are there any questions from the committee? Representative Oliver, who's online, is the $246,000 in the governor's budget? Or
it is not. And we've worked with OPB to talk about this. The governor told the agency heads at a meeting of agency heads that if we needed something more than we had to talk to OPB and to feel free to talk to the legislators about this. And so we have done that. We've communicated with OPB and they know we're here. So this is not under the radar at all. So no, it's not in the governor's current budget.
Okay. Are there any other questions online or from any of the members here today? Okay, well, I have one more then. About how many individuals, I know we've heard caseloads. Do you feel like, and I know this is a look back, but that you serve in the year, like as we finish up this year, you've said there's a higher caseload right now, probably
Yes,
than
ma'am.
you would prefer. But do you feel like that is increasing still, or?
It is increasing. Currently, we have to do our case counts by pulling up basically a spreadsheet and trying to sort of count them by hand. I hope that won't be the case in the future, and we'll be able to have more accurate data capture. It's one of our goals for improving our infrastructure. But very few of our cases, I mean, our cases are a child is at the center of our case, but I'm very sensible to the fact that there's a family, and often an extended family. It's being directly affected by what we do. So it's never just about one person. So, if we have 500 cases, we're very easily impacting directly the lives of 1,000 people, maybe more. And these are people that very often have not had the good outcomes that they deserve. And we're just trying to assist them in having those outcomes. Obviously, we can't make every case have a good outcome, but we can look and see where the system fails folks. Most of these failures are not intentional. They're just oversight. They're overworked. Their system is heavily overworked, and we're sensible of that fact. So we can't create good outcomes in all these cases, but we can try and remedy the deficiencies that lead to them. And that's our biggest goal.
Well, thank you. Thank you so much.
I was told, Chairman, by the judge at the case where we went down to Thomas County that, but for our intervention, the outcome would have been different. So I know that we're making a real difference in the lives of the families that we're working with. So thank you, Madam Chair, and thank you, members.
Thank you so much. I'm just checking just a minute to see if we have anything else online at all. Any other?
I always like it when you run out of time before the question.
Madam Chair,
Yes, yes.
this is Representative Donahue. I would like to ask a little question, and sorry, I was thinking I was unmuted, but I would like to ask, since he has come in 2021, I think he said June, what are some of the biggest things that you are going to correct? Because it was a very flawed system, and I deal with this quite a bit. And with it, I'm positive now. I'm not being negative. It's just I'm one that takes a lot of time dealing with people that deal with defects in certain situations. And you had to come in and say, wow, this here is broken. I'm going to fix it. Or this is pretty good, but we can try to channel our path down another path. And I just thought I wanted to hear that from you.
Thank you, Representative Donahue. That's a really good question. And I wish there were a super simple answer. The first thing I'll say is that I wasn't surprised by anything because I've been living with the system for a really long time. I mean, I represented DFACs and, I carried a bottle of aspirin around with me all the time, but that's what lawyers do for all their clients though. So DFACs was actually not different than that. The thing we have to remember about the child welfare system is that even representatives and members of the legislature tend to only hear about the worst cases, right? Those are the ones that happen when a child dies, when a child is seriously injured, when there's a terrible failure. And those things are actually very rare. I mean, we have 11,000 some odd kids in care right now. And a child deaths and fatalities are very rare for children in that foster care system. We save far more children than we lose. And it's never acceptable to lose anyone. But this is not a losing battle. We are fighting a very, I think, winnable and winning battle. We're making positive impacts on the lives of families and children all across the state. And the Division of Family and Children's Services is really working to retool itself from the top down to support case managers, to support the people on the front lines, to let them know that the work they're doing is important. So yeah, there are flaws in the system. It's easy to say the system is broken, but the system works more frequently than it doesn't. What we want to do is isolate those instances where it doesn't and make them even more rare than they are now.
Thank you very much.
Yes, sir.
Thank you. Are there any other questions? Not seeing any. Thank you. We look forward to working with you.
Thank you.
That was an excellent report. So next we will hear from the Department of Veterans Services, another new to us person, Commissioner Patricia Ross. If you would tell us a little bit about yourself too.
Yes, ma'am. Thank you for that. Madam Chair, the members of the subcommittee, it is my honor to be here. I think I get the prize as the newest commissioner. I started 1 December, so I am definitely brand new, but I am very proud to represent the almost 7,000 veterans that we serve here in Georgia. So thank you for hearing us. With me is my team, my Assistant Commissioner for Health and Memorials, Mark Bannister, the Assistant Commissioner for Field Operations and Appeals, George Canavaggio, Director of Operations, Carrie Dyer, and then our Budget Analyst, Kamala Ball. So I am backed up by a great team to make sure that I don't drop the ball on this one. So thank you for that. Next slide, please. Okay, here's our basic mission for Georgia Department of Veterans Service. I've broken it up into our program elements as we're talking about funding today. But the bottom line is we exist to support those almost 700,000 veterans and their surviving family members in filing claims with the Department of Veterans Affairs. We like to say nobody gets Veterans Affairs benefits without filing for Veterans Affairs benefits. And we are the state agency that for free does that for our veterans. So we're very proud of that fact. Additionally, we include skilled nursing facilities. We have 2 nursing homes as well as 2 cemeteries here within the state of Georgia that we support. Next slide. If you look at our organization, the one thing I do want to highlight, we've been looking at efficiencies and effectiveness within the department. That's been my focus over the last almost 6 weeks. We're divided into 2 regions for field operations. That's where most of our personnel and our budget goes from the state. And we've actually reduced our number of field offices as well as our itinerant offices. A couple of reasons. One, we just didn't have the throughput, and also because of manning, which I know is not unique to our agency. But the North region has 26 offices, the South region has 23. And we're also in the Atlanta regional office, which is where our appeals division is to assist and support those veterans who have been turned down by the VA and want to appeal that decision. Next slide. So a little bit about the population we serve. You see that we're 9th in the nation for our veterans. Actually, in the next couple of years, we're due to be 6th, and by 2040, we'll be 5th in the nation. I do want to say that we are 5th in the nation for bringing in funding in for the state of Georgia. And what that equates to is for just simply compensation and pension benefits, almost 4.27 million or billion, sorry, billion into the state through the Department of Veterans Affairs, but Georgia Department of Veterans Service is responsible for 3.3 billion of that. About 70% of what our veterans get from the Department of Veterans Affairs that they've earned and are entitled to is touched by one of our field offices or our appeals offices. I also, with COVID being front and center, kind of in our everyday mission, we do continue to provide services, primarily by appointments. We've adjusted and pivoted like most folks, but also by phone, communications via email, doing it virtually. Just so you know, we have an average about 10 scheduled visits for every field officer and about 25 to 35 phone inquiries or emails that each field officer handles each and every day. We do take walk-in appointments as we have the time available, but that's how we've shifted our operations in response. If we could go to the next slide, this is kind of a snapshot of what we've done over the last year. So serving almost 700,000 veterans, between that in-person and that virtual help, that's occurred 250,000 times with about 115 officers in our field. This has also, we've seen a rise, as you can imagine, in the number of folks we've interred, both our veterans and their spouses, to almost 6.7 thousand veterans, as well as we're caring for about 278 individuals in our nursing homes. That number has decreased, and I'll touch on that a little bit more in the next slide. The bottom line is we had to do this mainly by pivoting and becoming more agile. We also suffered from the great resignation and a downturn in personnel, along with state wages, which I know is being addressed in the amended budget. So if we go to the next slide, the main way we adjusted was by employing our training team. And thank you all so much. They're a fairly new entity within our department. But They are the ones that are training our brand new employees, are going out in the field and making sure that they're adhering to federal law, meeting all of the VA standards, are allowing us to be certified by the VA. They're tested. They test our folks. In addition, they go in and they actually review cases and records to make sure that we don't have any systemic issues in any of our offices. And then they then go deploy and help correct anything that we find. They're also helping with our treatment courts. So they're a very busy and small team that we are using across the state. Next slide. Also recently established is our Women Veterans Office. We're 5th in the nation for women veterans, and that population is growing, both in our veteran population as well as our active duty. So they do have some unique needs. And our Women Veterans Office helps with things like military sexual trauma, claims and appeals, our veterans treatment courts, connecting with other agencies to make sure we combat other issues like homelessness, suicide, mental health, and provide other counseling. And we've just started doing women veterans recognition ceremonies. This one happens to be a picture from earlier this month down in Vidalia. Next slide, please. Our war veterans homes, of which we have 2. In Augusta, we currently have 117 veterans. In Milledgeville, we have 161. As you can imagine, our new admissions are at a minimum due to COVID restrictions, but we do plan to open our admissions as soon as the numbers of cases decline, based on current guidance by the Department of Health, CDC, and of course, the U.S. Department of Veterans Affairs. We are doing renovation and construction projects primarily at our Milledgeville location. Recent renovations include thermal windows, replacement of flooring, LED lights, upgrade of intercoms, a modification, ADA modifications to our residents' rooms. They're now including bathrooms and some personal living space, which they didn't have before. And what we're really excited about is the internet wiring to make sure we have Wi-Fi access and electronic medical records. It seems like that should have happened a while ago, but we are working diligently to make that happen. Also, as part of the Milledgeville home, if you go to the next slide, is the only one of its kind for any of the states is our Sub-Acute Rehabilitation Therapy Unit. What it will do is it will provide mental health services. It'll provide occupational, physical, and speech therapists to be able to help our veterans who are suffering from things like post-traumatic stress, traumatic brain injuries, or the loss of limbs. We're about 80% complete, and we expect to open this late spring, early summer. And we are so grateful for the startup funding provided by the state. Operations will actually be funded by the VA once it's fully complete. Next slide. Where we've seen definitely an increase in business, unfortunately, are our cemeteries, but they are beautiful memorials for those that have passed and have served our nation. Originally, Milledgeville, which is our largest cemetery, we thought we'd have about 5 more years with a prepared space. We're now down to about 3 more years. And also last year, the state appropriated $1 million as matching funds for a 3rd proposed cemetery in Augusta, where we have about 60,000 veterans. And right now we're waiting on the VA to prioritize that for the federal funding. Next slide to just kind of jump into the amended FY22 budget. Next slide, please. Okay, this is our overall budget. We are happy with the budget as it addresses our very main issue, which is low salaries and high attrition. We do want to attract talent. The overall budget does reflect that $5,000 increase for each employee, but it did take into account the personnel numbers at the end of the fiscal year and not necessarily the positions. So I'm sure you've heard that from more than one agency. If we go to the next slide and dive in a little bit deeper, the first of 2 fiscal programs, our departmental administrative budget and our Georgia Veterans Memorial Cemetery at 48.1 reflects the governor's recommendation at just over $1.8 million. 48.11, of course, reflects $76,761. That's directly for that $5,000 pay increase for our full-time employees. What we may get questions on, line 48.1.2 is actually a transfer. Our previous commissioner retired. This is the program line his retirement should have come from, but we did not have the budget. So this is being moved from field operations or our veterans benefit line so we can pay out his retirement. So the total amount of funds in the administrative program is just over $2 million. Next slide. This is our Georgia Veterans Memorial Cemeteries. Line 48.2 is a $1.7 million in state general funds. We get about $2 million in total funds, basically through plot allowances that we get from interring our veterans and their family members. If we jump down to line 48.2.1, that's the $84,000 or just over in state general funds for that $5,000 increase for all full-time employees. They had a very high operations tempo, as you can imagine. We did have some positions vacant at the time the snapshot was taken, and we do have them filled now. But as you can imagine, they've been very busy, especially during COVID. And the average salary for those cemetery workers is just over $12 an hour. So we are definitely appreciative of an increase in funding for them for a total amount of $1,836,808 in state funds, with just over $2.1 million in total funds. Next slide, please. Okay, looking at our Georgia War Veterans homes, 48.3 reflects $12 million in state general funds and $38 million in total funds. That increase at line 48.3.1 of just over $1.1 million is the $5,000 increase. And that is not only just for Georgia Department of Veterans Service employees, but also Augusta University employees who of course run our Augusta home. 4.3.2 provides $150,000 to purchase two 12-passenger vans, transport buses for the Milledgeville homes. Those are sorely needed, as the bus we had was constantly breaking down, and we had to have somebody with a CDL Class B certification to drive it. So this eliminates that requirement and allows us to get our veterans to the appointments that they need to get to. Total program dollars for that is $13,308,240, with a total of just over $39 million in total funds once you add federal funding to that. Next slide. Moving to our fourth and final program, Veterans Benefits. This is our one-on-one service to veterans. It's $7,319,749 in state funds. A little bit more than that for total funds, $8 million. That is the VA funding our education and training as the state approving authority. 48.4.1 increases the state funds by $610,702. That's that $5,000 again pay increase for full-time employees. It also includes that transfer from this program line item of that $80,355 for the retirement of the previous commissioner, and that's what was in the departmental administrative budget. So it comes out of the appropriate line. The total funding from the state is $7,850,096 for just over $8.6 million in total funds. Madam Chair and the rest of the subcommittees, that concludes my briefing of the AY22 budget, pending your questions.
Okay, thank you. That's a good report, good update. Are there any questions here or online? I do have some from Representative Oliver. If anyone else have any to add at the moment, well, we can start with those, and she may connect. She's trying.
Can you hear me?
Yes,
It's
great.
so
Come on. Right.
Have you been with the Veterans Agency before? My sound and connection's gone in and out. Or are you new to the agency?
I am brand new to the agency, Representative Oliver. However, I have served as their chair for the last 3 years of the Veteran Service Board, was on that board for a total of 5 years, and previous to this position, had stood up and was running the Georgia Veterans Education Career Transition Resource Center in Warner Robins, again, still supporting our veterans, but in partnership with Georgia Department of Veterans Service. But
So that was
no,
a
I am
federal-
brand
that
new
was-
to the agency.
That was a federal position you had in Warner Robins?
No, ma'am, it was state. It falls under the technical college system.
Oh, okay. Well, welcome. Thank you.
Thank you.
All of the state agencies, I know the governor told y'all not to ask for any new money. It looks like the only new money you're asking for, other than all the salaries and retirement, other than your predecessor's retirement, are the 2 buses. Am I correct? That's the only new money you're asking for?
Yes, ma'am. And that is in the governor's amended budget.
Right. And in relation to your numbers at your 2 nursing homes, what are your total numbers now? And have they gone down or have they gone up? Because I've been watching a trend over the years that they've gone down.
Yes, ma'am, they have gone down. And there's 117 are currently in our Augusta home. We have 161 in Milledgeville for a total of 278. That has gone down over the years, mainly due to COVID. You have to understand that these facilities, both of them were built about 53 years ago, which was more of a communal model for skilled nursing care. And we've had to reduce the number of patients we take in because they were in 4-person rooms. And so those 4-person rooms now have 2 people. We are trying to get to a newer model for skilled nursing care. And I understand that there's at least been proposed a committee to study that. But yes, ma'am, we have had, specifically due to COVID and infection control, had to reduce our numbers. In addition, our Milledgeville home has undergone some tremendous renovations. And so once those renovations are complete, we'll be able to increase our numbers at that facility. Again, coming into ADA compliant, going more to a more modern, a skilled nursing model.
Madam Chair, may I ask one final question?
Yes, ma'am.
I've also been trying to remember and track the number for the subacute unit. Is that all state money, the building, the renovation, or is there federal money involved also as a partner in the creation of the unit?
The answer is yes. No, it's not all state money. It actually was seeded by the state. It is a matching project with the Department of Veterans Affairs. So starting operations does end up being on the state. However, that is going to transfer completely over to operations through the Department of Veterans Affairs and their funding.
I understand that. I understand the services are going to be paid for by federal. My question is about the creation, the building, the getting the building up towards start of services. Is that all state money?
No, it's not. It was $6 million was the state, and the matching from the federal side was $11 million.
Thank you very much.
You're
Appreciate
welcome.
it.
Okay, do we have any other questions? Not seeing any. Thank you so much. We appreciate your presentation and the work that you're doing, that all of you are doing.
Thank you. Thank you so much for your time.
Great. And so now we'll have another new to us, Commissioner Candace Broche and team getting in place. Looking forward to your presentation. And we are ready whenever y'all are.
All right, good afternoon, Madam Chair Dempsey and subcommittee members. I'm honored to join you to discuss the governor's budget recommendations for the Department of Human Services for amended fiscal year 2022. And I have several members of my team with me today, but I will point out I have my Deputy Commissioner for Finance, Demetrius Taylor, here, and Assistant Deputy Commissioner for Finance and DFAC CFO Cliff O'Connor here at the table with me. As I mentioned in my joint budget hearing, our workforce is deeply thankful for the governor and First Lady's workforce package, including a historic $5,000 pay increase the enhanced employer match, and the option to withdraw leave as pay. For some of our frontline workers, that pay increase alone amounts to a nearly 20% increase in their base salary, a truly life-changing reward. You'll see in each of the respective program budgets in AFY 22 adjustments to reflect those workforce incentives. But for the sake of time, I won't go through each of those, instead focusing on new additions to AFY 22, starting with Departmental Administration. That's page 3 of 7 of the House Budget and Research Office's tracking sheet. In line item 28.7.2, there's $4,016,595 slated for enhancements to the state's integrated eligibility system, Georgia Gateway, which is used to determine a person's eligibility for benefits like Medicaid, food stamps, temporary cash assistance, childcare, and utility bills. When budget development was underway last year, our agency was working closely with the Department of Community Health, the Office of Planning and Budget, and the Office of Health Strategy and Coordination to build new functionality into Gateway for the governor's healthcare waivers, the 1115 Medicaid waiver called Georgia Pathways, and the 1332 waiver called Georgia Access pertaining to private market insurance. But since that time, there have been several important developments. Last week, state officials filed suit against the Biden administration for revoking the qualifying hours and activity requirement in the Medicaid waiver. And given the existing expertise of the Department of Insurance, functionality that was previously slated for Georgia Gateway will now be handled through a different technology platform at their agency. So to be very forthcoming, our agency will not be able to spend the roughly $4 million included in this specific line. Rather, we expect to utilize $2,179,534 to ensure compatibility with the new system at insurance and our existing gateway system, for those systems to talk to each other properly. Next, in the Elder Community Living Services Program budget, which is page 4 of 7, line item 28.9.2, you'll see $2,718,854, which will draw down $37,993,513 in federal funding from last year's American Rescue Plan. And with that match, the state will serve an additional 5,731 clients over the next 3 years with supportive services, congregate meals, home delivered meals, and additional caregiver services. And just for some background, in FY21, we served over 40,000 clients with those home and community-based services. My team has shared a detailed breakdown of the funding allocations for each of the 12 area agencies on aging where we do this work. But we also have hard copies if anyone would like to see those, so you can see a breakdown of the funding. And with that, I will conclude our agency's AFY 22 budget recommendations, pivoting now to discussion of specific FY 22 updates for this committee. First, I will reference $6.7 million that was originally added to the FY 22 budget on the Senate side, initially designated for therapeutic foster care. This funding was added to ensure collaboration with the Department of Community Health for more therapeutic services reimbursable under Medicaid. But our federal partners have not granted full approval. In the interim, these funds can be redirected for immediate needs, specifically the ability to cover more services for children by giving us flexibility to use it with an amended caption. When I was appointed DFACS director last summer, I began working with my team to aggressively reduce the number of children in our custody being hoteled, which in other words means being temporarily placed in a DFACS office or hotel because we could not find a foster family or group home provider able to meet their needs. We developed a strategy to increase per diem rates for providers who agreed to take a child out of a hotel or an office if they provided enhanced supervision and tailored care. There are also restrictions on that provider from unilaterally ejecting that child, which usually occurs because the child's behaviors escalate into crisis, requiring significantly more resources to stabilize and often resulting in property damage or injury to staff. Back in July, when I first joined DFACS, we were averaging 50 to 60 children being hoteled on any given day. Since then, we've kept over 60 children from ever being hoteled. Statewide, we've decreased the average number of days that any child spends in a hotel or office setting by 19%. And by December, we had managed to get down to the 30s, the lowest it has been in years. Unfortunately, Delta and Omicron have temporarily sidelined our efforts as child placing agencies and group home providers were forced to take placements offline. But as cases decline, and since the state is working on deploying emergency staff to key providers to expand capacity, we expect to get back on an aggressive path very soon. In fact, we expect roughly 20 emergency staff to be sent out to specific providers next week, pending completion of their background checks. Longer term, I am committed to finding better placements overall and more tailored placements for all youth in our care, even those with the most complex health needs. And with this revised caption, as we work toward that goal, we can continue to enhance per diem rates to get youth out of hotels and offices. And right now we're on track to utilize this funding in its entirety by fiscal year end, with roughly 4.1 million encumbered through supportive services contracts for behavior aides, therapists, and healthcare professionals providing care in a child's home, be it with their biological family to prevent foster care, in their foster family's home, or in the group home setting. So now I'm happy to take your questions.
Excellent. Thank you for that update. Are there any questions from the committee here or online?
Madam Chair.
Yes, thank you.
The governor's increase by 10% of child placement services per diems is very positive. But I'm trying to figure out exactly what the plan is beyond the 10% in terms of finding new placements. If it is true, I think it's true that Tennessee's daily per diem rate is over $600 per day for the most intense placement, and Georgia's per diem rate is $408. That means that our state Georgia institutions are going to continue to take children from out of state instead of Georgia children. There's only a handful of, I'm very concerned about this disparity right around us of per diem rates. A 10% increase is not going to get us close to Tennessee. And I'm trying to figure out how you're going to create new placements when our per diem rates are so low. And what further confuses that for me, and I'm sure you could explain it, is who sets that per diem rate? Is it DCH, or is it AmeriCorps, or is it you? And it's always been confusing to me. You're
It was very
making a
confusing.
significant effort. And the question is, really, how are we going to get out of this hole if our per diem rate is significantly lower than other states?
So it is a very confusing array of determining those rates, who makes that determination, what is Medicaid reimbursable versus what would be simply covered with state funds. So I'll do my best to cover it all. I think the best way to describe our efforts is that we're looking at a multi-pronged approach, and we are working with the other health agencies to make the most effective improvements. And so, you know, of course, if we're talking about the highest needs setting, we're talking about a psychiatric residential treatment facility. And if the child is on Medicaid, which all foster care children are, then they are, their stays there will be covered by Medicaid, but it will be administered by AmeriGroup, which is the only managed care Medicaid provider that the state uses for children in foster care with other populations. So we try to maximize, no, let me say, we don't ever want a child to have to go into a psychiatric facility.
Mhm.
Although I know that other states may have higher rates, really for Georgia, and I imagine other states want this role too, we don't want to have to keep talking about competition there, because in Georgia, we don't want them to go there at all. So although DCH works with our managed care provider to set those rates, my agency has significant legal flexibility to cover it with state funds if, for whatever reason, there's pending authorization, or if there's a disagreement as to whether the child should be placed in that facility. And that legal flexibility exists essentially across the spectrum. So I hope I'm kind of answering this question. We will continue to compete with other states whenever we have a disparity in rates, but ultimately I don't really want to look at the battle that way. My concern more is that we need to focus on preventative services to keep children from ever coming into foster care. And frankly, it's a better bang for the buck, because if we're getting to them earlier, we're preventing escalation. We are seeing a rising rate of families who abandon their children to foster care because they feel they can't meet their health needs, as opposed to what people would traditionally consider child abuse or neglect. So right now we're trying to aggressively fight hoteling, but the longer term approach here is preventative services and recruitment of foster families for those children.
I think preventative care obviously is more cost effective, and it's something that we all can work on. One follow-up question, if I may, Madam Chair. The newspaper tells me, but I don't understand where it is in the budget, that you brought in 2, 3, 4 new deputy commissioner with different titles, all of whom are making sort of higher salaries. Is that reflected in the budget in terms of a budget adjustment in any way?
No, ma'am. What I did was to better align, since I'm serving in a dual capacity. What I found when I moved over to DFACS and then at DHS is that there were certain divisions that were distinct and independent, but there were some that were still shared. And when we looked at it as a whole, it really seemed that we would benefit from trying to put everyone at the same table so we could better collaborate, because the mission of the agency as a whole is to be able to best serve any Georgian from birth till death. That transition through life should be as seamless as possible. And so what we did was we utilized existing funding in the agency to make that adjustment. And so far it appears to be working well, although we'll continue to check benchmarks that it is the right structure for the agency. But we were able to utilize existing funding and really bring parity across the agency for the people who served in deputy director roles within DFACS and the people who served in deputy commissioner roles at the DHS level when they were more distinct.
Thank you.
Are there any more questions? I have a couple of quick ones. So the pay raise, how do you anticipate this helping? And does it help at all in the hoteling challenge that you're facing?
So for the pay raise across the agency, of course, our agency has, for our frontline staff, they are some of the lowest paid state employees. They also do some of the most critical work. But I think if you were to talk to them, they're going to tell you they don't do the job for the pay. They do it because they love the work that they do. Now, the pay raise, though, has really lifted their spirits. It's remarkable to already see how excited they are about what that means for their longer term service in state government. But I think what's important, too, is the additional supports, the enhanced match, the ability to withdraw pay or leave as pay for emergencies, for example. That's huge for employees who have families and have unforeseen needs, for example. So that's welcomed. In terms of how that affects hoteling, I think it really does help us retain some of the most dedicated staff that we have. And that's important for us to achieve our longer term goals. So those staff who are working really hard right now, that are volunteering, frankly, after hours to help us find placements for these children when it's not, in their core job description, it's great that we'll be able to keep them. That pay raise is what's helping us keep them.
Good, good. So one more question. In the original ask for matching ARPA funds for elder community living services, there was a local match that needed to be covered. Have the AAAs been able to do this?
We have asked, they have told us they feel comfortable being able to meet their match. I don't know if you may have heard something more recently from them. I think they're still comfortable doing that, although it would be, I think we all know that it would be helpful if they did not have to provide that themselves, but they do say that they are able to meet it.
Okay, that's great. One more ask. Any other questions or comments? Well, thank you so much.
you.
Very, very good presentation.
Thank you.
Appreciate it. Okay, before we bring up our next speaker, I want to remind everyone that if you have not signed up, I believe there's a sign up sheet right here. If you would like to make comments or ask questions, you can still do that. And also just remember, we are focusing on 22 amended, not 23 when you do sign up. Okay, so with that, next, our next presentation is from Georgia Vocational Rehab Agency Director Chris Wells. Good afternoon. You were hiding back there behind that column. I'm glad. I was afraid you were just going to be on Zoom. This is great.
No,
Great to see you in person.
thank you. Thank you for having me, and just want to thank the committee and everybody for giving us the opportunity to be able to present. And I have with me our Director of Administration and our Director of Finance and Budget as well. So I'm going to try to do this a little bit different through the phone. And so our budget is pretty straightforward. Again, I'm Chris Wells with the Georgia Vocational Rehabilitation Agency. Again, we serve individuals, eliminate barriers that may have a disability. We're approximately 1,000 employees stretched across 5 programs. And again, we help individuals eliminate barriers for employment. But our next slide. Pretty straightforward. Our budget is associated with retention and recruitment. As you'll see in line 2820-1, we received $36,133 for the 5,000 pay increase, as well as $365,257 on line 2821.1. Our DAS, our Disability Adjudication Services Program, which is line 28.22, is 100% federally funded. So based on the 5,000, that's state funds, but we've already been in communication with our partners with the Social Security Administration that all they'll need is just the signed budget articulating the governor's goals and objectives, and that should be no problem, no concern at all. And then we're looking at GIB. They're also other funded. So again, part of the 5,000 is state funds. And so we're working with GIB to be able to, see how that ends up working out. For 28-24.1, that is one of our biggest programs, Vocational Rehabilitation, which includes Roosevelt Warm Springs. We received $1,549,149,149 $1,549,142. And again, this is the state funds percentage. VRs, typically we hear about the match is 80-20. So we've done some initial analysis, and that will fully cover. So there's no concerns there. For 28.24.2, this is part of a continuation. We definitely want to thank the General Assembly, especially Chairwoman Dempsey, for the start from last year during our first presentation, where we were asking for funding for to advance our case management system. We're actually in the process of testing right now, which is going pretty good. But what we uncovered as we were trying to become a little bit more virtual is we received funding for the actual system itself and the interface, but we also had to make some adjustments to our case management system in order to receive the data. And so we, OPB saw that as a viable option. So they provided an additional $100,000 to complete the link up or the connection. I think Commissioner Candace Brose kind of articulated about having your systems talk. This is very equivalent to having a case management system talk to our interface. And so we're hoping that that system is going to allow us to serve more individuals throughout the agency or throughout the enterprise. Right now, VR is heavily focused on in-person intakes. And so we're hoping that this funding and the completion of the website portal, again, will allow us to kind of move forward to be able to serve individuals virtually. Our slide is broken down into three different sections. So on our next slide, it kind of articulates kind of where the positive impact of the 5,000 increase. You'll see over the last few years that GVRA has seen a decline in the number of overall state employees. This is due in part due to the restructure that the agency undertook starting in FY 2020, starting with admin and then going into FY 2021, which we completed most of the restructuring from the Accenture report. And so what you're seeing as a combination there is the restructure taking place in the middle of a pandemic, which we're seeing some impact there. But our projections kind of show we're kind of stabilizing. But again, as you can see over the last few years, we are seeing those declines again due to the restructure, also due to COVID, and as we consider the Great Resignation. Next slide. Our next slide kind of talks about our counselors. We get a lot of questions related to our counselors, and that's pretty much the bread and butter on the VR side. Related to being able to serve individuals and being able to serve our clients. And as you can see there, back in 2013, we probably had the largest set of counselors then. And so over time, there's been changes throughout the agencies and business practices and business models where we've adjusted and made a couple changes here and there. And so we're kind of going back to the original model, focusing on our CRCs, focusing on how do we impact the clients and less about support and more about that interpersonal relationship. But as you can see over the last few years, we are seeing a decline in the number of counselors. But our goal, and we expect with the 5,000 in amended as well as in the base, that it's going to help us tremendously. Our next slide. And our next slide basically kind of gives a little bit of an estimated impact of the data over the last few years. As you can see, we closed priority categories coming into FY 2020 to help us kind of stave off the potential pandemic, as well as be able to address our counselor situation. And so we're seeing that that has impacted our ability to kind of serve. And so you'll see there just a decline over the last few years. But again, what we're trying to focus on and how we're trying to get back to serving our clients. What you see there from a goals perspective is just where we need to be in order to serve all of our Georgians throughout the state. And so we feel that with the path that we're putting forth and the direction that we're going in, as we continue to stay on the path of focusing on our clients and focusing on individuals in the field, that we'll be able to meet those goals over the next few years or so. It's a pretty ambitious plan, but we have goals and objectives, and we have a way to kind of move forward. Our next slide. And our next slide is just a few follow-ups. We just wanted to kind of circle back on a few things that we have articulated in the past and kind of where we are. Our network infrastructure, as you can see, one of the biggest delays is when we first came into the agency, we had a lot of old laptops, old ports, old systems. And so we made the attempt to update all of our websites, all of our locations to be able to increase our bandwidth. I think for the most part, we've concluded this particular project. However, the issue that we're running into is the supply issue with chips. Is also impacting our ability to finish some of our software upgrades and as well as our ports in various offices. So right now we're estimating another 2 to 3 months before we can completely finish our network infrastructure project. We mentioned earlier about the GVRA application portal. Again, that's going well. Testing is currently going on, which we've brought our providers in, a few of our stakeholders, and we feel positive that as we move forward, this gives us an opportunity to serve our clients from a virtual platform instead of having individuals come into the office on a regular basis. Priority categories still remain closed. We're still working to address our priority categories based on some of the financial decisions that we have made over the last 6 months to a year. With Jonathan and Mamta overseeing our financial and our administrative operations, we do feel that we're aiming for a July timeframe to try to open up those priority categories. I think as we note from our previous slides, part of the negative connotation with priority categories being closed is individuals believe we aren't serving individuals. And so we feel that once those priority categories open up, we'll see a flood of individuals wanting to come through the door. Also bringing on our online portal will give individuals the opportunity to apply for services instead of coming into the office. We do get a lot of feedback from our providers that when they send the client over, sometimes it takes a little bit longer. This is going to give our providers, our school systems, our stakeholders the ability to work with a client to get them signed up from their home, from their business location, or wherever they may be. So we feel very excited about that. And then lastly, one of the things that we're trying to do is look at our residential infrastructure down in Warm Springs. We feel that that's going to be where we can start to really serve and really expand services. We have a really ambitious plan that we talk about a little bit later on in the presentation, but due to time, we can, if there's enough time, we can kind of talk about those updates. But our residential infrastructure plan is kind of designed to build capacity. And what we want to do with our residential program is, I believe back in 2012 or so, when our new residential facility came on board, we decommissioned our older facility, which we went from 250 beds down to approximately 125 beds or so. And so that resulted in, not being able to serve as many individuals. And so we're setting forth an ambitious plan to try to bring on some of our campus infrastructure, some of our things online, even if we start today, because it's ambitious with RFPs and some of the things that we have in place. It could be anywhere between 18 to 24 months, but I think this is the perfect time to start. We do have some bond capacity where we're working to develop a plan to submit to not only OBB, but to GISFIC and the General Assembly about looking at how can we utilize existing funds to get some projects in place instead of having some bonds sitting there waiting for additional funding to complete some of those things. And then Georgia Industries for the Blind, again, out of Bainbridge, they do a lot of hard work. We've been working with them a lot this year. Supply chain issues have really caused us to look at how we operate that particular manufacturing plant down in Bainbridge, but we're working hard to bring some things online as well and to work with that particular team. But that's one of the areas that we're continuing to working hard to help those individuals to be able to move forward. All right. Next slide. This is just a little bit more information on our priority categories. And again, you can see over the last few years that reduction has taken place partly because we closed priority categories. Part of this is also a follow-up in terms of a small explanation in terms of what it means for you to be involved in a priority category 1 versus a priority category 2, priority category 3. Right now, again, priority category 1 still remains open. Priority category 2 and 3 is closed. However, if individuals were being served prior to those categories being closed, we continue to serve those individuals. So you're seeing that decline from 2019 to 22 as of December 31 is fairly related to priority categories being closed itself. But again, our goal and our objective is based on some of the financial decisions that we've made is effective July 1. We're going to push to try to open up those priority categories to ensure that we're serving our Georgians. Next slide. This is one of the slides here. Just wanted to kind of talk about, one of the things coming into the agency a year and a half ago is what is the plan? What is the goal? What is the objective? How do we serve more individuals in the state? And so one of the things that our team looked at very closely is first identifying how many Georgians out there that could potentially qualify for GVRA services. Before you know where you need to go, you have to basically set a target. And a lot of this is very ambitious, but it's something that we first need to set that path, and then we need to start moving towards those goals. And so this slide basically gives the committee an opportunity to kind of look at where we are. Georgia's population as of 7/1/2021 is about 10.8 million. There's about 8.7% of the population there is considered to have a disability. So that leaves about 939,000 individuals in the state that potentially could be eligible for VR services. When you take into account over the last 12 years or so, what that disability employment participation rate is 23.3%. compared to the population at whole, which is 67%. So what we did is we look at what is that population? How can we go after individuals to make sure that we are available, that they know that they can come to GVRA for services? We also looked at a targeted population, working with the Department of Education and pulling some of their IEP and 504 plan data. These students that are in our school systems, these individuals are potentially eligible for our services. So they don't have to be a VR client. They don't have to go through the VR process, but if they are on a 504 plan or an IEP, they're eligible. They receive services related to counseling services, job exploration, some of the basic services to let them know these are some of the possibilities. These are the things that we can help you with, and these are the things that we can get started. And so we try to work closely with our local school systems to be able to encourage that particular involvement. because if they're part of that particular conversation with VR at the early stages, it's easier for us to move them along through the VR process, which has been considered one of the hardest processes to go through. So we're starting from the basics here. And when we look at that, you're looking at about 89,122 students that we should be serving. In comparison, we're serving about 10,193. So we're a long ways away from where we need to serve, but now we have a plan. We know what that population is, and we know where those individuals are. And so when you take into account 218,918 individuals that would be potentially eligible for VR services, including the 89,000, now we know what that number is. Now we know how to divvy up resources to ensure that we're serving individuals. And so the remaining part of the presentation kind of talks about starting from the beginning, setting what that overall goal, what that population should be, and then being able to have a conversation about long-term, what do we need, how do we move forward, and how are we most impactful in how we're serving our Georgia citizens. That concludes the most part of the presentation. We do have a few more slides if we want to go through them, but that kind of sums up the homework related to what is that population and how is GVRA setting forth goals to be able to serve more individuals.
These last slides.
Oh,
that would be
perfect.
great. No, just, yeah.
No problem. Our next slide basically is just talks about, again, massive goal. What are our projected cases? What are our current cases? Where we are right now, where we need to be? What are the estimated counselor positions and pre-employment positions that we need? And so pre-employment is those individuals that are going in our school system, working to be able to get our students with those plans, the ability to start that process of potentially exploring college, exploring GVRA, exploring our partners that we work so closely with. We have 157 providers. And so we do have a pipeline and a family and a community of individuals that's chomping at the bit to be able to help us be able to serve our Georgians. And so we're trying to put those plans in place to be able to do that. And so this is kind of a breakout of, again, where we need to be. And again, we're not going to get there tomorrow. We're not going to get there in a week, but it does give us a roadmap to say, this is how we get there. Our next slide. And so our next slide just talks about, your basic projections. And again, we talked about big numbers. And so these are big numbers related to how we serve individuals. But again, we have to start with the basics first. And I think if we start with the basics, we'll eventually be able to serve more and more and more. And so this was part of the homework assignment. And so this is kind of how we were able to show these are the potential needs long-term. But these are the things that we're working on right now to be able to develop that plan, to be able to provide more information to show how we're reaching those goals long-term. Our next slide. Part of that conversation talks about transition. And so we talk a lot about general cases. We talk a lot about adults, but a lot of times we have to start. I used to be a high school teacher. And so one of the things that as a high school teacher teaching, again, geometry and algebra 1, is it was very tough when you would get a student coming in. And if they didn't know the please excuse my dear Aunt Sally, those order of operations. It's hard to teach individuals geometry when you have to go back and teach them the basics. And so what we're looking at is, let's go to the basics. Let's look at our transition services. And so these are some of the goals and objectives that we have in place. If we go to our next slide. Our next slide talks about setting service targets. We've done that, and that was part of the homework. The second was integrating transition and residential services. When we took over the program, and I think Commissioner Brose kind of talked about, those synergies. When you have an organization or you have certain programs and you're looking at things from silos, it is very tough to get everybody on the same page. And so we're looking at our transition in residential, having weekly meetings, making sure everybody is having those conversations and communicating. It seems very simple, but it's very tough when we're very territorial. I'm selfish, and my wife will tell you that on a regular through outreach. As of this week, we have started the process of trying to reach out to every single special education and transition provider to be able to let them know this is what we're doing, this is how we're trying to move forth. And then we talked about building residential capacity. We have a jewel in Warm Springs, and we have a 900-acre campus that can serve numerous individuals, but we're not maximizing that particular capacity. And that's because we haven't put that emphasis. And so under my watch and under the leadership that we have in place, we're pushing every penny that we possibly can to ensure that we're serving more individuals through our internal resources. And long term, we can reach more individuals and we can get more individuals through the VR process as well. Our next slide. And so we talk about our transition, and we highlighted this to basically say that 89,122, that is the number we need to hone in, because we need to have that particular goal in place to serve every single student. And so we have that process, and now we know what we need to do. Next slide. Our final slide kind of talks about our residential investment, and we kind of mentioned this before, is I believe we had a campus assessment that was performed a few years back. That's one of the first things that we need to look at, a campus assessment, and we've been able to kind of work internally to look at some federal dollars, look at some things to be able to really look at every aspect of the campus to figure out what are some of the needs. Our Latham Cottage and Sarah Roosevelt Cottage, those are the two closest ones that we have available. And those cottages can be used as independent living quarters. They can also be used to help us for transition related to training and getting our staff. We all know that training is key. We're a statewide agency, so we may have individuals in Savannah that needs training. We can easily house those individuals at no cost because we already have that infrastructure sitting on the campus itself. MK Moore, our cottage there, we're looking at our autism center to be able to bring that back online to be able to serve more individuals, psychology services. And what we're also trying to do as well is, because we have the infrastructure within the agency itself, is why not leverage the internal resources? So bringing that MK Moore Cottage back online gives us an opportunity to use existing resources to actually send our clients internally, so they're not waiting for assessment, so they're not waiting in line. So we can get those individuals through the VR process using internal resources, and then sending them back out to our providers that, again, chomping at the bit to be able to serve. So we're hoping leveraging our internal resources and what we currently have as a state is going to give us an opportunity to get individuals through the process a whole lot quicker and be able to help our providers be able to help us serve our clients. And so these are some of the investments that we're planning on making in the next 6 months to a year. And that's all about using existing capacity, leveraging existing resources to do the things that we need to do to be able to get some of these facilities online and serve more individuals. Next slide. And again, one of the things that I'm probably more excited about is Camp Dream. I think if individuals aren't aware, is we have a really good opportunity on the Roosevelt Warm Springs campus that we're looking to invest. And again, we're going to try to use internal resources, move some things around to be able to get that camp online. But our thought process was as simple as this. When you talk to Georgia Tech or UGA, Georgia State, some of our colleges and institutions, every summer, you have camps, you have individuals that are going, they're learning about the campus, and they want to be part of that institution. We have a resource in our backyard that we can bring online, and we can serve those 89,000 students. So our plan, as we put these things in place, is 11th and 12th graders, as we go into the school system, if we can grab those 11th and 12th graders, bring them on campus in camp. If they're starting camp on Monday, by Friday, they should be able to explore Roosevelt Warm Springs, which is set up very similar to a college, be able to explore those opportunities. They can get assessment services, they can get psychology services. We can work with our Department of Education to get their records, and we can actually get individuals through the VR process a whole lot quicker. I think our next slide kind of shows and talks about how long it takes to get through the VR process, 185 days. If we were to invest in that camp and we were to look at having those 11th and 12th graders on campus, there shouldn't be a reason why we can't leverage our internal resources in order to get those students, 11th and 12th graders, in a VR process and get them back out into the workforce to be able to serve those individuals a whole lot quicker. So again, this could be transformative change. But it's something that I believe in. It's something that we all should believe in. And it's something that I think we will get done. And so it's all about just changing the mindset, looking at how we can do things a little bit different. How do we take advantage of the resources that we currently have and being able to act on those particular resources. So I believe this concludes the majority of the presentation. Again, I get very passionate, so I apologize. But we definitely have a plan in place. And I think that was the charge when I was presented this opportunity. What is the plan? What is the goal? And how do we get there?
Thank you so much. I know that Representative Oliver has some questions.
Thank you.
Let's see if she can begin.
I'm really confused, and I apologize that it's probably the gaps in my paying attention. But we were talking about the 22 budget today, and I want to go back to the slides that says you have 33,000 recipients of services in 2015, and today you have 15,000 recipients. That's a very significant, it's more than 100%. I mean, that's a big drop.
Correct. And I think
And how much of that, and I know you've cut off new people walking in the door for services. So how much is that gap from 33,000 people you're serving to 15,000 people you're serving related to COVID? And how much is related to a redesign of your services that you've been talking about for the last 5 minutes at Warm Springs? I'm kind of confused.
Gotcha. So you're absolutely right. So backing up from the beginning. So we believe we're not 100% sure in terms of whether the individuals that due to the drop, whether it's specific to COVID or whether it's specific to the closing of the categories. We do believe, however, the majority of the reductions are coming due to the closing of the priority categories. Because
what does that mean? Does that mean you ran out of money to serve them during 22, or does that mean you closed the doors? I can't figure out that.
So correct. So during the FY 2020 budget, when we were asked for the 6% as well as the 14% reductions, GVRA took approximately a 20% reduction overall related to VR services. So the decision was made based on the number of individuals we had coming into the door and based on the projected need that we would not be able to serve all individuals. So the decision was made to close priority categories 2 and priority categories 3 in order to make sure that we can at least serve those individuals that were in priority category 1.
Okay, when did you make that decision?
That
In
decision
22
was
budget?
again.
In
That
22
decision, that decision was made coming into January of 2020. 2021 when that decision was made.
Okay.
So what you're seeing there is due to a closing of the categories as of January 2020. One is there has been a reduction in the number of individuals that are walking in the door, as well as some of the other things that we articulated earlier. So our goal is to open up the priority categories because we do believe individuals here, priority categories 2 and 3 are closed and that GVRA is closed for services. So we do believe that based on some of the calls that we have received, that is the negative connotation that's out there. So our hope is as we communicate an opening of the priority categories that we do anticipate an increase. And what we don't have on the slide is the increase in applications that we've seen over the last 6 months. We've seen a 40% of our of the number of applications that we've seen over
But
the
you haven't opened the door to them yet.
correct.
They're sitting in your waiting, 40% increase sitting in your waiting room.
So the 41% shows the number of applications that are coming through the door. And so we are trying to open up those categories to be able to serve those individuals. What we have done in partnership with our federal partners is we are still serving those individuals. We are still serving overall. But again, we do feel that the communication related to categories 2 and 3 being closed, that individuals aren't walking in the door itself. So our hope is that once that communication goes out, that we're going to see an additional flood of applicants coming in the door.
Thank you, Madam Chair.
Are there any other questions from board members or anyone online? Committee members, I'm sorry. None? Not seeing it. Representative Oliver, did you get all of your questions in? Or
Yes,
do you-
ma'am. Thank you.
Okay, great. Excellent. So you feel that this pay raise is going to help with retention at this point?
Yes, ma'am. I believe based on what we're seeing, we're losing staff to our counterparts, to the Department of Veteran Services. We're losing individuals to our federal partners as well that can just pay a whole lot more. And so we do feel that the additional $5,000 is going to allow us to scale off a little bit of what we're losing and what we're seeing.
And the vacancies and employees are really the reason that the categories cannot be reopened right now? Is that the major reason?
So right now, we feel that we have made the decisions on the financial side to be able to open up those categories. However, it's going to be numbers, the individuals. As you can see on the slide, we have 101 counselors in comparison. And so even if we open up the categories right now, the question is, how quickly can you serve them? So it is a two-part process. So excellent question. We do feel that we have the financial flexibility to be able to start those categories being open. But between now and then, we're hoping with the 5,000 starting to hire and pick up, that's going to allow us to bring some more counselors in the door to be able to serve more individuals.
And do you feel like there is the possibility of doing that in this fiscal year?
So right now, it's funny that you mentioned, we've made some adjustments in terms of how we recruit. I think that was part of the challenge from the committee as well. And so one of the challenges that we took on, and we included in the packet itself, is the agency was recruiting at the master's degree based on our federal policy and plan that we put in place. We've in the last month, we've submitted a new plan to the feds to allow us to recruit at the bachelor's degree level to be able to serve. We had a recruitment out that ended in January, and the initial review of those applicants showed that we had 11 counselors that would have qualified under the master's degree only. And so once we pulled back and looked at the bachelor's degree plus experience in the relative fields, which we included in the packet itself, our client or our counselor pool went from 11 to 41. So that's a significant difference in terms of that pool of individuals. And so we do feel with those changes, with those adjustments, that it gives us a little bit wider pool. And then with the additional $5,000, that's also going to help us kind of move the needle a whole lot quicker. So we are in the process of pulling those applications and recruiting, and we're hoping that we can bring those individuals in, and then we'll start another recruitment process as well.
Well, great. Well, I know we all hope that you can do that. The needs are great. And I hear from Georgians and their families how much the need is really there. So thank you.
All right. Thank you.
I don't see any other questions. So
right. Thank you.
Appreciate it. Okay, next we are joined online, I believe, by the Council on Aging with Chairman Vicki Johnson. Ms. Johnson, are you able to unmute your mic and speak to us?
I am here. I don't know. Yes, I can see myself, so I hope you can see me too. Yes, well, good afternoon, Madam Chair and committee members. I greatly appreciate this opportunity to testify today remotely. My name is Vicki Johnson, and I am the chair of the Georgia Council on Aging. And I am also the chair of COAGE, which is the Coalition of Advocates for Georgia's Elderly. Our agency and our coalition speak on behalf of 2.5 million older adults in Georgia, and we represent 23% of the state's population. Your consideration of the amended fiscal year 2022 budget comes at a time when seniors are still reeling from the impact of COVID-19. Early in this pandemic, senior death rates from this virus surpassed all age groups. Today, as we face a highly contagious Omicron variant, many older adults remain fearful and hesitant to risk exposure to infection. Isolation has become one of the greatest health threats for today's seniors. The American Rescue Plan Act, signed into law in March of 2021, earmarked $1.4 billion to fund programs to help seniors who have been so badly impacted by COVID. States were allotted special funding for Older Americans Act programs and for vaccination outreach, infection prevention, and mitigation for this targeted population. Georgia's share of these earmarked ARPA funds is 37.9 million, which would be available through September 2024. However, to draw these funds, Georgia must provide funds of 8.1 million in a match, and the state portion of that match is 2.7 million. As you heard not long ago, the remaining 5.4 million match would come from local communities. Together, this $40.7 million state, federal, and local funding would provide over 20 million for congregate and home delivered meals, almost 13 million for home and community support services, 4.6 million for family caregiver programs, and 1.2 million for health promotion. Every region in the state has a wait list of eligible older adults in need of this assistance. For many, the alternative would be institutional living in costly nursing home care. We commend the governor for recommending that the state provide its match of 2.7 million for the amended FY 2022 budget. This one-time expense will pay huge dividends and ease the burden imposed by this pandemic on thousands of at-risk seniors. COAGE and the Georgia Council on Aging ask for your favorable consideration of our request to sustain the recommendation from Governor Kemp to include 2.7 million in the amended FY 2022 DHS Elder Community Living Services budget, line 28.9.2. Thank you.
Thank you. Are there any questions or comments from the committee or anyone that's joining us online? Not hearing any. You did another great job of informing us. So thank you so much, Ms. Johnson. We appreciate you.
Thank you.
Thank you. Okay. Our next presenter is the Department of Behavioral Health and Developmental Disabilities, Commissioner Judy Fitzgerald.
Good afternoon, Madam Chair, members of the committee. I'm very pleased to have the opportunity at this unprecedented time for mental health to bring you the amended fiscal year 22 budget for the Department of Behavioral Health and Developmental Disabilities, starting always with a note of gratitude. We appreciated the speaker's compassionate remarks and call to action yesterday, and just also want to acknowledge many members of this committee have been longtime champions of the people we serve. So it's an exciting time to talk about what the future might bring. So here to advance the conversation today, I have a brief presentation for you in 3 sections. The first thing is I'm going to provide some context for the numbers that we'll talk about, provide some agency updates that you all asked for, and then we have a single item in the amended budget. So we'll discuss that last. So this first slide, thank you for having it up. This is a familiar slide to many of you. Georgia's public safety net, Dbhd, is Georgia's public safety net. And I'm not going to go through all the items here, but it really shows the robustness of the safety net that we have built in Georgia, all the elements of it, from our hospital system to our crisis services, community service boards, and where those are located throughout our region. The main point I want to remind folks that as the public safety net, our priority population are individuals with severe and persistent mental illness, people with substance use disorders, and intellectual and developmental disabilities who are uninsured, receiving Medicaid, and at the highest level of need. Next slide, please. Okay, so how did we build that robust public safety net that you see on the map there? What you see here is also a familiar slide because you all supported investments year over year. Even if you can't read the numbers there, what you can see is from the period of 2010 up to 2022, we have made a dramatic investment in community-based services. So these are state appropriations year over year. The investments are remarkable. The blue line are community dollars. I do want to draw your attention to the green line. We've made note of that as well. That's our hospital funding, which has remained relatively flat over the years. Next slide. Okay, so y'all asked for a couple of agency updates, so I want to bring those to you again for additional context just about our overall budget. The first item, you all were seeking some updates on our provision of services for people with intellectual and developmental disabilities. Next slide, please. So I want to do that. I want to share some information, but I also want to share some context because anytime we talk about what's happening for people with intellectual and developmental disabilities, I want to make sure everybody's clear about the current state of service delivery and the challenges that we face right now. So I shared this slide previously in the joint session. It's, I think, an important representation of the challenges that our providers and our communities are facing as a result of workforce shortages in communities all across the state. What you see here very specifically, and these numbers came to us from SPAD, as you know, for the provision of intellectual and developmental disability services, we operate through a network of providers throughout the state, small and large. What you see here is a compilation of a concerning trend. Pre-pandemic, this was a concern that had been reported. Now, in the midst still of the pandemic, the problem has worsened significantly. And the point I want to make here, you see really, I think, alarming numbers about a 60% turnover rate, vacancy rate, and the limited amount of experience that folks serving really complex and at times people who need a great deal of support have less than a year of experience who are doing that. So I wanted to just remind you of this context, let you know it's affecting our communities, it's affecting our providers, but I think you're going to be hearing from families as well about what this means for them, because you see a key point there. Families are having to make difficult decisions. So I wanted to set that context before I talked a little bit about giving you some, next slide, please, numbers about services for intellectual and developmental disabilities. So wanted to give you an update on current numbers. As you know, we have two community-based waivers, the now and the comp waivers. Year over year, you have supported individuals moving into community-based settings. As a result, as of January of this year, we have approximately 13,077 individuals on waivers in communities all around the state. You also see another number that you asked for, which is how many people are on the planning list in Georgia at this time. That number is 7,097. Now, a little bit of good news. I know you all have been interested in this. How can we help? How can those providers be helped? You know, since we're at this crisis point, you can see we did submit a 5% rate increase to the feds. Let me back up. You all know we can't do a rate increase without approval from CMS. And we needed our comp waiver to be approved. Our comp waiver is pending with CMS. So in partnership with our sister agency, the Department of Community Health, we used Appendix K, which we've used for other financing flexibilities during the public health emergency, to submit a 5% rate increase. We await word on that now, and we anticipate actually that it's coming soon. When I say soon, I do want to say within the next month. And please note that if approved, the increase will be retroactive to July 1st, 2021. I want to note this is temporary, it's critical, it's essential, but we also know that it's temporary, and we're looking forward to, once again, approval of the 5% rate increase that you all approved last year. Again, this is for our providers in IDD. One other exciting update. Progress continues on the IDD, Behavioral Health Crisis and Diagnostic Center is what we call it. I'm really pleased to tell you that 2 of our community service boards, Gateway and River Edge, have partnered to really put together the plans for a state of the art. This will be the first of its kind, certainly in the state, and it will be probably like nothing else in the country when it's built. I did want to give you an update that we anticipate those plans are well underway for sort of what's really a complex and unique service delivery site, and construction will begin late this fiscal year. I want to thank you again for your investment. This is going to serve a very specialized, targeted group of individuals who do not have a place to go. Many states struggle. I'm really proud to say Georgia took a step forward to say we are going to figure out how to do this. Between those 2 community service boards, they're also seeking ultimately university and other partners to really help build something that's innovative and state of the art to serve people with intellectual and developmental disabilities when they're in crisis, but likely need a really lengthened assessment to understand how we can best serve them in the state. So very happy to give you those updates. Next slide. Okay, now I'm going to pivot to behavioral health. This is a busy slide that you all saw during the joint session. I'm not going to go through this. The reason I wanted to bring it back today was because as we begin this conversation about what can we fix, what can we improve, I want to remind you what we built and how many people are being served. It really is important to note that. So you see a lot of the investments we've made in mobile crisis, in crisis centers, in Apex, which has been such an important program for youth, in housing supports, all of that's being put to work. But now I'll draw you back to really one of the concerning points of the slide, which is the 24% increase in calls in FY21 in outreach to GCAL. The point here is the demand has increased beyond what we can serve right now, but I do want you to see the ways in which those dollars are at work. Next slide. Okay, also a familiar slide. This slide is specifically talking about state employees at Dbhd's 5 state hospitals, which many of you are familiar with. It's a difficult slide for me to look at, as I imagine it may be for you as well. What you see there is since January of 2020 until now, we've experienced a net loss of 1,096 state employees. And it's important to say this because we've worked really hard to keep the safety net doors open despite these challenges. So if you ask, how do we do that with this degree of loss? There's 2 things I really want to say. Number 1, we have an incredibly dedicated workforce. So while you see over 1,000 people left, thousands more stayed. And every day, at risk to themselves, they face some of the most difficult frontline jobs in the state, and they keep coming back. I'm really proud of our hospital teams, and I really want to make sure that their dedication and commitment to the people we serve is recognized. The second thing, I also want to thank Governor Kemp and of course, our partners at the Department of Community Health who have supported staffing augmentation through Jackson Healthcare for us. So since very early in the pandemic, we have had staff augmentation that continues today. That's been vital to keeping our safety net doors open. Okay, next slide. It's important to note this and to be really specific, because I want folks to understand, because you are hearing from every agency, every industry about what happens when we have workforce vacancies. But I feel like it's important for you all to understand what happens in public behavioral health systems when we do not have the workforce. So what you see here is a graph from August of 21 to the end of 21, and the number continues. And what this is essentially, you might, as you would imagine, our 5 state hospitals are accredited. They have quality standards for staffing ratios. And if they do not have the staff to serve the patients, we take beds offline. So I just want to be clear about what that means, is that we essentially have backups in our system. People wait. We can only serve the number of individuals that we have the staffing to serve. What I want you to see here is, unfortunately, that number of beds offline is worse now than it was a few months ago. This is a great challenge for us. And as you contemplate budget discussions ahead, I do want you to be aware of how challenging this is for our hospital system, because what you all know, many of you have been around this for a while, when people with in a psychiatric crisis can't be served in the deepest end of our system, our hospitals, they land in emergency departments and jails and in communities and in places where that's not where they're going to get the treatment that they need. So you see the numbers there, and we've averaged it essentially 185 beds offline quite recently due to those workforce shortages on any given day. Okay, next slide. I did not show you this slide before, but I do want to make note of it, because while that slide only reflected beds offline in the hospital, I do need you to be aware that the same thing is happening in our community crisis units. As you might imagine, they too are struggling with workforce shortages. So what you see here, and this is a compilation of our adult and our child and adolescent crisis units all around the state. And in Q4 of 2021, we were down 15%, again, of crisis beds that are offline. And what you see in the Q1 this year, 28% of crisis beds offline. Once again, demand has increased and capacity has decreased. This is the challenge you're hearing about. We're certainly hearing about it. We're here to talk about what are ways that we can address that. But I do want you to be clear about that. You know, it's important to be grounded in the numbers as we talk about the budget. So we'll keep bringing to you as best we can what it looks like in real time. And that was our effort today. Okay, next slide. Thanks. You can proceed to the next one. So we only have one item in the amended fiscal year 2022 budget, and it's one you've seen from several agencies. And this is sort of the first payment of Governor Kemp's $5,000 raise for state employees. I can't say enough about what this means to state employees, particularly at our state hospitals, folks for whom, and I'll say a number, about 62% of the people in our hospital make less than $30,000 a year. So a $5,000 increase is going to be really meaningful for a lot of people. Having this money pushed out quickly in the amended budget is especially helpful. A really, I think, important recognition of the vital contribution that they have made to our state. So we are so grateful for this, really positive, really important, and I think an important down payment on a workforce that really has met the challenge throughout the pandemic and prior to that. And then I'll note just one other thing. Every time we bring you budget items, we're going to keep trying to do this color-coded system where we tell you what problem we think we're trying to solve and what problem we think this will address. So you can see there, this one got 3 colors. We hope that if we reduce the number of employees we're losing, we can bring more beds back online. Blue, also maintain care environments, because our workforce losses are across. They're frontline care, but they're also cafeteria, food service workers, and maintenance and all other things. So we hope to be able to maintain those. And of course, this is orange for a statewide adjustment. So it's a powerful addition, and we're grateful for it. Happy to bring it to you for your consideration. Next slide. I think that's my last slide. Yes. And of course, happy to entertain questions.
Thank you. Are there any questions from the members here or online? Representative Oliver, I think you might have a question. Your microphone, can you unmute? We can see you.
I'm sorry.
There we
Forgive
go.
me. I don't believe we have time this afternoon, but I'll follow up with you. But you're probably aware the speaker got a question yesterday at the press conference. What's the total cost of this package for 1013? And you have a piece of it. You don't have all of it, obviously. I assume you started working on that question.
We have heard
Okay,
there's a
good.
short timeline, so I'm surprised I have budget people in the room, but I do. But we understand, we appreciate what comes behind it is a real commitment, and so we'll be working on the numbers.
Yeah,
As
I'm
quickly
not
as we
asking for it now. Secondly, the most extensive question I've gotten since yesterday is, what are you doing for children's services?
Yeah, great question.
And I'm not asking you, again, I'm not asking you to answer it right now, but I think that, because we don't have time to go into that, but it's a pretty important question. And again, you have a piece of it. And I had a conversation with the DHR commissioner earlier in the afternoon. What piece does she have and what piece does Medicaid have? And we need to have a good conversation about children's services. Thank you.
Yeah, thanks. We'll look forward to it. Thank you.
Not seeing any other questions. I do want to take a moment just to say one thing. I know you've spoken to the number of vacancies really in your employment force, and that was probably pretty lean actually, but about 1,096, what was up here, so a little over 1,000. And the pay raise will help you with retention, but does it really impact these vacancies that would be considered new positions?
Yeah, so I think that remains to be seen, right? We're all on watch for what can a $5,000 increase do? I do want to say the retention's critical. I want to work as hard as we can. We've got talented, experienced, skilled folks working for us. Anything we can do not to lose them, I think that's a very worthwhile investment. But across every industry, I think everyone's looking at, will these advancements really bring new people in? Will they impact the vacancies? I think that remains to be seen. Again, as I mentioned, we've got a low paid workforce, and really challenges ahead for how we meet what we think is going to continue to be increased demand.
Well, thank you for all that you're doing. I do want to make you aware, and it's not a surprise, but the now and comp waivers are very, very important to so much of our population. There's so many people, we may hear some in some of the comments later, but I'm well aware of people that have reached out and would like to really, as always, figure out a way for us to reduce that number. And I understand the number, and I can explain as to why it doesn't seem to go away, but just always know that in the hearts of many are that we continue to try to come up with that way.
Thanks.
pathway.
We'll look forward to more conversation on that as well. Thank you, Madam Chair.
Thank you. Thank you so much. Okay, now we have some more comments from people that have asked to. And the first is Representative Regina Lewis Ward. I believe she's in the room, maybe. And if not, I know she was here. Let's go on to our next one, then we'll come back. She may just be nearby. Diane Wibbish, I know, Willish, okay.
I have
With SPAD, thank you.
yes.
Yes, thank you.
I have a handout for you. I'll also send it to you electronically. I just didn't have an
Thank you.
opportunity.
Thank you. We'll make sure everyone who's not here or who's online gets a copy too.
Okay, very good. Thank you. Thank you, Madam Chair, for the opportunity to address the committee today. Oh, and Juliana's giving you a set too. I'm Diane Willish. I'm the CEO of United Cerebral Palsy of Georgia and South Carolina, and I also serve as the administrator of SPAD, which is the Service Providers Association for Developmental Disabilities. Come to speak to you about the dire circumstances of the workforce in the now and comp waivers in our home and community-based services. We are delighted for the recognition for state employees, for hospital employees, for school teachers and others, but we are struggling, we are drowning, we are at a crisis point. And I don't want to contradict any of the data that the commissioner gave you. They have been wonderful partners in this last 2 years, and really always, but certainly in the past 2 years during COVID, and done their level best to get resources to try to help us. So some of the data on her slides that talk about 60% turnover rate, those are current data. What I gave you on our handout was 2019 data from a national survey. What our problem is that our wages are based on waivers that considered a hourly pay rate for a direct support professional at $10.62 an hour in 2015. That was the state's rate study that revealed that's what a DSP, a direct support professional, should be paid. That was not viable then. And as you might imagine, the problem has only compounded over the ensuing years. We have circumstances around the state where providers are closing, some temporarily, some permanently. We have situations where families are being able to asked to take their loved one home. Even in my own organization, we've had to temporarily close homes because we just don't have the personnel to provide the service. I think you well know, Madam Chair, that the DD community providers have partnered with the state long and hard to provide quality community services, to partner with them to achieve the settlement with DOJ. However, we are drowning. I don't know how more dramatically I can share with you the crisis that we are in. The 5% increase that you all were so gracious in awarding us, a permanent 5% increase last session, those funds have yet to come to the community providers. What the commissioner mentioned, which is a relief valve, they're going to temporarily give us that 5% through the Appendix K. Again, it said it could be a month. So we're almost a year out of that 5% permanent money. We appreciate lots of efforts with some temporary money that enables us to provide bonuses and so forth to personnel, but we can't recruit with saying you're going to get a bonus, but that money's going to go away and we're still at a $10 or $12 an hour pay rate. In my own organization, we have 160 some positions. We're a statewide organization providing a lot of 24/7 care around the state. In our organization, we have 200 vacant positions. We can't get applicants. We can't not recruit. We can't compete with state hospital jobs. So our ask is this, the need is great. It's a crisis, truly. And I don't throw that word around lightly. I always tell staff in our organization, if it doesn't have a siren and a flashing light, it's not an emergency. This is an emergency. Is that we would like you to allocate another permanent 5% increase that then would get us to 10%. The aging waivers, rightfully so, got 10% last year. We got 5%. And as I mentioned, we still don't have the 5%. If we could get 6.125 or 6.150 million in the amended budget, and then annualize that in the 23 budget, that would get us a little bit. That will put 10% total on the wages of direct support, who now are at $10.62 an hour. It's a real crisis. People are in danger. It's not a healthy situation. People aren't getting services. We know the wait list is important, and then I'll stop after this. We know how important that is. That's our mission of all of our member organizations. We are not accepting new people because we can't provide the services. So even 100 new waivers, it's wonderful. We're happy for those families, but they're going to come to organizations that can't serve them. So our plea is to really think about this workforce that is your partner in community-based services, enabling you to meet the DOJ settlement. Thank you, Madam Chair. Happy to answer a question.
Thank you. Are there any questions here or online? Don't take that as the fact that we are not aware. We really, really are, and appreciate how much you've stretched.
Yeah, thank you. Thank you. We appreciate the support. And last year it was wonderful, but we're really struggling. And following me is one of our members. I think she's next on your list, Susan Bolenbutz, who's one of our community-based SPAD members, to share some more information.
Thank you.
Thanks, Diane, and thanks to the committee. My name is Susan Bolenbutz, and it's my great privilege to serve as the CEO at the High Hope Center in Lawrenceville, Georgia. We serve Gwinnett County. We are a 62-year-old not-for-profit organization that provides an array of services to adults with intellectual and developmental disabilities. We currently have 80 employees, a $5 million operating budget, and across all of our programs serve 182 individuals. As Diane and others have said, our sector has been so incredibly hard hit by the after effects of the pandemic. Two key stresses. One is that we do not have a workforce. The second is that problem is resulting in financial duress of organizations like ours. Currently in our residential program, group homes, we have a 38% vacancy rate across shifts that are covered by direct support professionals. We have tried to address that recruitment problem. We've increased pay by 36% since last April. We have gone from $10.50 in April to $14.25 in November. Even with that rate increase, we've been able to hire one DSP since Thanksgiving. It's pretty significant. We're also paying additional hourly differentials to our existing staff so that they will pick up extra shifts for us. We've also, as Diane mentioned, we've instituted intermittent closures of group homes, sending families, sending individuals home to many times very elderly families, asking them to take a week so that we can give some DSPs a break. In our weekday program, we are currently not serving people who are ready to come back after the pandemic because we do not have the staff. So we have individuals sitting at home who want to return, but we're telling them we cannot serve you right now. Our DSP vacancy rate in the day program is 44%. I think it's really important for the committee to understand that providers like High Hope, who are nonprofits, we don't expect the state to do it all. We are in partnership with you. And as a result, we raise a lot of money out there for this effort. Over the last 6 to 7 years, High Hope has raised in excess of $5 million to support quality initiatives, capital projects. In addition to that, we did our best to get our share of all of this pandemic funding. High Hope brought in a little over $2 million in extra pandemic emergency funding. Despite all of those efforts and the temporary 10% waiver rate increase that's in effect through Dbhd's efforts, we're experiencing a cash burn of $77,000 a month. So our board finance committee is meeting tomorrow to look at what in the world are we going to do. It most certainly has got to include some service stoppages somewhere to avoid our own insolvency.
Can you tell me that amount one more time? Just the amount.
$77,000 a month for this fiscal year. I'd also just tell you that I have had communication from other service providers in our area. 2 of them, one of them has closed a group home as a result of no staff. Another one has discontinued in-home services to individuals as a result of the staff shortage. I've also heard from 2 family members that are not served right now by High Hope, but are reaching out trying to find service because their existing service provider has discontinued service because they do not have enough staff. So as Diane has said, I don't begrudge a $5,000 increase for state employees at all. I am absolutely certain they deserve it. But as a partner to the state of Georgia, I'm not able to offer that right now to our employees. And ensuring that we can recruit and retain these DSPs is just as critical, I think, as retaining state hospital workers. So as Diane has said, we are asking that in this current budget that you all consider putting in an extra $6.15 million that we can pass directly on to direct support professionals. So I just want to close and say that we're trying to be a good partner. We're trying to bring in extra resources to bear on this problem, but we have done all we can do and need the assistance of the state in order to keep doing what we do so well. So thank you so much for the opportunity to present.
Thank you for making us even more aware. Appreciate it. Okay, next is Shelley Simmons. Are you? No. Let's see if she can come right here. Wait just a minute. Let me get make sure we have you on. Let's see if that works, Shelley.
Testing,
We'll pull it a little closer and it'll get her a little bit more.
testing. I cannot hold it actually. Good afternoon, Chairman Dempsey, and to the subcommittee members, thank you so much for the opportunity to speak with you. I do have just a couple of items for you. We can set it here on the table for your review later, and I will make sure I could just set there on the table that the rest of the committee members will receive something later on today. But I'm here to advocate for the Independent Living Network of Georgia, the Centers for Independent Living, and the Statewide Independent Living Council. In mid-2020, under the direction of Governor Kemp, the Georgia Vocational Rehabilitation Agency cut our budget significantly. Initially, we were preparing ourselves for an 18% cut, but the Centers for Independent Living received 100% cuts in their budget in state and supplemental funding. And the Statewide Independent Living Council lost 25%, totaling $809,980. The only funding that the Centers for Independent Living receive is the 10% federal match of $64,000. And that's a far cry from 809. Jobs have been lost for people and individuals with disability across the state. Services have been delayed, not denied. The staff has continued to work with significant burnout because they're doing 2 and 3 jobs at a time. What I did provide with you is our annual report, and it also provides some of the personal stories of each center across the state. We actually have 9 centers across the state. But we believe that the restoration of these funds of $809,980 will help us strengthen the existing centers, will help us to rehire and hire qualified individuals, because there is a standard that we have to abide by through the federal government and also through GVRA. So there has to be a certain criteria that the employees have to have. So we will be able to hopefully be able to rehire these individuals so that they can provide a continued service throughout the state in unserved and underserved populations. We believe that on the grassroots level, that the Centers of Independent Living are best qualified to be able to provide these services. And again, so like so many others before me, we partner with many of our state agencies, like the Department of Aging Services, helping with transition services, GVRA with their pre-employment services. But that has been challenging. So we have not been able to earn money because we're not receiving the referrals from some of these, from GVRA. We have a great partnership with the Department of Aging Services, but we do partner with the Department of Community Affairs for home access program. So it's not as though we're just looking for federal and state funding. We do partner and try to leverage some of our funding. But with the significant cuts of 100%, some of our smaller centers are really struggling to survive. The CARES Act did help, but we're now starting to feel the brunt of 100% cuts. And we just don't know why we received that significant amount of funding cuts. So if you would carefully consider restoring that $809,000, the centers will be able to, again, hire and rehire individuals, strengthen the existing centers as they are, and also be able to outreach to the underserved and unserved counties of the state. I will answer any questions for you at this time.
Question? Are there any questions online? I'm not seeing any, but you know that knows, doesn't mean how much we care.
Yes.
It's so good
I
to see you.
Thank you. So good to see you too.
And I appreciate so much all that you have done throughout this time. And we will be talking.
Thank you so much.
Thank you. Take good care.
You do the same.
Okay, and next, Amy Hughes.
Thank you very much, Madam Chairman and committee member and members online. I appreciate the opportunity to speak, and I know the hour is late and I will be very brief, but I wanted to call something to your attention for the FY22 budget and opportunity, the amended budget. Yeah, I'm here representing the Amy Haywood Hughes with Hughes Public Affairs, representing the Matthew Reardon Center for Autism, which is based in Savannah, Georgia. It is the only year-round accredited day school for children with autism outside of Atlanta. And it serves a very wide swath of Southeast Georgia where people travel to bring their children to this program. Children who have not been successful in the public schools and come to the Reardon Center when they're sort of at their wits' end. The Reardon Center provides very intensive programs to the children to help prepare them to go back into the school system. And it also has an advocacy program where they work with parents to help them advocate for their child's best interests back into their public schools. And both of these programs have had a long-standing funding contract with Dbhd. Well, think back to 2020 in June, and where we were at that point. And if you recall, we had come back and we essentially had the budget cuts that came, where there was a 10% funding cut to the Matthew Reardon Center for Autism for those two programs as part of the state contract. So that was $67,500. So the important thing to know is that if you think about children with autism and the unique challenges that they experience, which you're all very familiar with, think about this. Think about a child with autism and mask. Think about, just the tactile experience of it. Think at how it blocks facial experiences. Picture them trying to study online in Zoom classes. That's not an option for children with autism. So the Reardon Center did not shut down except for that mandatory shutdown period. They kept going. And of course, the needs increased dramatically from children who didn't have their needs met in their home schools. So what I'm asking you is if you found $67,500 in the supplemental budget that was available to restore that 10% budget cut, it would be very much appreciated. They never shut down. They kept on going. Thank goodness for the P3 program that helped sustain them during that time to absorb these cuts. But that restoration would be very much appreciated. Thank you very much.
Thank you. Are there any questions? Any online questions at all from anyone? Not seeing any. Thank you. Thank you for that presentation. We know how important that center is actually for South Georgia families, for sure. I believe Representative Barton and Chairman Oliver and Representative Anulowicz all get a pat on the back for hanging in here with us, for sure. Thank y'all so much for being here and listening. I appreciate the work that each of you are committed to, and to each of you who are out here still too in our audience that are strong advocates and representatives of so many others in our state. I just want to thank y'all so much, and without any other business, this hearing will be adjourned. Thank you so much. Safe travels to you all.